In this instructional video, we will discuss the process of filling out a periodontal chart. Given the complexity of the chart and the importance of accuracy, both the dentist and the assistant should be focused throughout the procedure. Once you are done from reporting your patient's chief complaint, medical history, past dental history, extra and intraoral examination, oral mucosa inspection, teeth charting, you may start filling the periodontal chart. A complete periodontal chart provides a concise record of the current dental status and the existing periodontium. The periodontal chart should record the following: missing, extruded, tilted, and rotated teeth, plaque score, bleeding on probing, periodontal probing depths, level of gingival margin, forcation invasion, mobility, presence of defective restorations, overhangs, and caries.
This is the periodontal chart that you will be using. It is a simplified version since documenting all the periodontal parameters would be a lot during your time in the clinic. Begin by documenting the patient's name, file number, age of patient, smoking and diabetic status, type of exam conducted, whether it is initial exam, a re-evaluation, or a maintenance exam. Don't forget to record the date of examination as well. Next, cross out any missing teeth. And record the presence of implants. On the left side, you can notice the parameters that you will be recording. You will record the pocket depth, the level of the gingival margin, presence of bleeding or suppuration, presence of plaque, forcation involvement, and mobility. Except for mobility, all other parameters will be filled out from the facial and palatal sides of maxillary teeth and from the facial and lingual sides of mandibular teeth. The most effective approach to complete the chart is through a systemic method. Begin by addressing the upper right buccal side, meticulously filling each corresponding box. Proceed to the upper left buccal side, then wrap around to the left palatal and subsequently to the right palatal side. Once this is completed, shift focus to the lower jaw. Start with the left buccal side, followed by the right buccal, then the right lingual, and finish the examination with the left lingual side. The first score to be recorded is plaque score to avoid disturbing the plaque during periodontal probing. As previously mentioned, commence the examination from the upper right side, specifically from the distobuccal aspect of the most distal tooth. Assess whether plaque is present using the probe, recording a value of 0 if absent and 1 if present. Repeat this procedure for all sides, ensuring comprehensive coverage, and report findings to your assistant. Progress systematically around each tooth, assessing the distobuccal, midbuccal, and mesiobuccal aspects before transitioning to the subsequent tooth. Once plaque presence is documented, calculate the percentage using the provided equation. Let's analyze this chart. We counted the boxes marked with 1 to indicate plaque presence. There are 88 sites with plaque, which serves as the numerator in the previous equation. Considering that there are 22 present teeth, we multiply this by 6 to determine the total number of examined sites, resulting in 132, which acts as the denominator. Therefore, dividing 88 by 132 and multiplying it by 100%, the resulting plaque score for this patient is 66%. The subsequent step involves recording the probing depth and assessing bleeding on probing. Begin once more from the upper right last tooth, probing the buccal surfaces until reaching the midline. Check for any signs of bleeding and report a 0 value if bleeding on probing is absent and 1 if present. Subsequently, continue to the buccal side of the upper left quadrant, followed by the same sequence of charting mentioned before. After completion, calculate the percentage of bleeding on probing using the following equation. If we look at the chart again and count the bleeding sites, the numerator will be 91. 91 will be divided by 132 and multiplied by 100%. The percentage of bleeding on probing is 68.9%. Gingival margin is recorded next using the periodontal probe. It is recorded as a positive value if the gingival margin is apical to the cemento-enamel junction, as a negative value if the gingival margin is coronal to the cemento-enamel junction, and as a 0 value if the gingival margin is at the cemento-enamel junction. Don't forget to start from the upper right side and move forward. When assessing forcation involvement, note that the buccal forcation of upper teeth is recorded from the buccal side, whereas the mesial and distal forcations are recorded from the palatal sides. Conversely, for lower molars, record the buccal forcation from the buccal side and the lingual forcation from the lingual side. Next, record the grade of the mobility of each tooth in its assigned box.
Finally, we will record the clinical attachment level, which represents the distance from the cemento-enamel junction to the tip of the periodontal probe during normal probing. If the gingival margin aligns with the cemento-enamel junction, the clinical attachment level is equal to the probing depth. If the gingival margin is coronal to the cemento-enamel junction, the clinical attachment level is calculated by subtracting the gingival margin from the probing depth. For instance, if the probing depth is 9 mm and the gingival margin is 3 mm coronal to the cemento-enamel junction, the clinical attachment level would be 9 minus 3, which equals to 6 mm. If the gingival margin is apical to the cemento-enamel junction, the clinical attachment level is the sum of the probing depth and the gingival margin.
رح نبلش هلا من البلاك سكور from the distal buccal of the upper right 7. Zero, 1, 0, 0, 0, 0, 0, 1. هلا بعد ما سجلنا البلاك سكور لكل التيث رح نبلش بتسجيل البروبينج depth from the distal buccal of upper right 7. 3, 3, 2, 3, 3, 3, 3, 2, 2, 3, 2, 2, 3, 2, 3, 3, 2 3 3 2 3. هيك احنا بنكون بلشين from the distal buccal of upper right 7 to the mesobuccal of upper right 1. رح نشوف هلا ال bleeding score لهذا الكوادرنت. نرجع بنبلش from the distal buccal. في عنا من mesobuccal of upper right 7 في 1 السكور. distal buccal of upper right 5 1. باقي 0 4 3 3. بعد ما خلصنا هلا البلاك سكور والبليدنج اند بروبينج والبروبينج ديبث لكل التيث، رح نرجع نشيك الفيريكيشن، الجنجفال مارجن والموبيليتي.